Welcome to episode 242 of the Fabulously Keto Podcast. And today I'm chatting with Jen Unwin, who is joining us for the third time. And we're diving into the topic of food addiction and her upcoming conference. During the interview, Jen shares a generous 40% discount for the event, whether you choose to attend in person or via the live stream, or to watch the recordings at your own pace. And if you do come along in person, there's an extra bonus. You get to meet me too. I'm running a workshop next week called Start Your Day the Right Way, the breakfast reset to boost your energy. Now, if you have a real food addiction, like we talk about in this issue, just resetting breakfast might not be enough. But if you just want to try changing one meal, your breakfast, this might be perfect. So go to fabulouslyketo.com/breakfast-guide. Download the free guide and you will have a link sent to you to sign up, or in the show notes of this episode. Or you can just go to fabulouslyketo.com, wait for about 10 seconds, and a pop-up will appear and allow you to click the link. So anyway, let's find out a bit more about Jen. Dr. Jen Unwin, BSc, MSc, D Sci, C Psychol, FBS, S, consultant clinical health psychologist, past chair UK Association for Solution Focused Practice, winner of the British Psychological Society Karin Lifetime Achievement Award in Clinical Health Psychology, co-founder of Food Addiction Solutions. Dr. Jen Unwin has spent her professional life interested in the role of hope in chronic disease and how it can be used to bring about behavior change. Her insights teamed up perfectly with Dr. David Unwin's interests in bringing about drug-free type 2 diabetes remission. For over 13 years, they have been running group sessions in primary care to achieve just that. So far, more than 150 patients. Both doctors were featured in a BBC TV documentary, The Truth About Carbs, that was seen by 3.7 million viewers. Jen has written a book, A Fork in the Road, and is part of a team that published the first ever treatment study in the field and coordinated an international expert consensus on food addiction. So let's go and hear from Jen. Welcome back, Jen, to the Fabulously Keto Podcast. It's fabulous to have you back for, I think, the third time.
Is it 3 times? How fantastic. Thanks for having me.
And I was just thinking this morning that your conference that's coming up is at the Royal College of General Practitioners.
Correct.
And that's where I met you back in 2019.
A PhD conference?
Yeah.
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 It's a great venue. It's
yeah.
very, very central and lovely.
So yeah, we've known
That was when we first met. Yeah. So that's 6 years ago now.
Yep. Excellent. So you've got a conference coming up. So we're going to get onto that in a little while. But why don't you update us? Because you came on with Heidi the last time. And why don't you update us with what's going on with everything in your world?
Everything food addiction, which I'm obsessed with. Right. So yeah. So Heidi she set up a new charity called the Collaborative Health Community, and it's got 2 projects in it. One is Food Addiction Solutions, which is mostly me and her, and then a growing team of willing volunteers, which is brilliant. We're all voluntary. And then also Collaboration for Kids, CFK, which is a project based on, how do we basically save people from themselves and getting into the mess that we got into? How can we help families and children to make better choices around food and not be drawn into this kind of ultra processed food pit?
Sales marketing pit.
Yeah, exactly.
It's just a marketing thing, isn't it?
Marketing. It's these foods are sort of literally engineered, manufactured to be addictive. We know that now. Like, we've all read Chris Van Tulloken's book and we've all seen the sides. So yeah, so that's a sort of preventative arm, which is of course massively important, and trying to get the word out there. And then we're Food Addiction Solutions, which is all about, our sort of mission is to develop effective treatments for people with food addiction. One route to that, of course, is actually getting food addiction recognised as an official condition, because I don't know if people know, but you can be diagnosed with a gambling disorder or a alcohol use disorder or a drug use disorder, nicotine use disorder, but you cannot be diagnosed with an ultra processed food use disorder. So we've that's one thing that we're working on. Yeah, effective treatments, educating healthcare professionals so that they can recognize food addiction in the clinic, because it's 14% of the general population, but it's much, much higher in people with type 2 diabetes, people with eating disorders, people with obesity, much, much higher rates. So really, I mean, my argument would be there's hardly any healthcare professional that shouldn't be able to recognize food addiction and have a decent conversation about it and know what sort of general advice to give. So those are some of the aims of that part of the charity. And I'm pleased with where we've got to, really. Well, Heidi and I'll be talking about it actually at the conference, like where we feel progress has been made in the last 5 years. But particularly this year, or last year, we did an exercise we called a consensus exercise, where we contacted as many people working in the field as we could, either as academics or as clinicians, or sometimes people are doing a bit of both. And we managed to get 40 people to agree to take part in this process, which was sort of online workshops and then discussions and documents, trying to get a real consensus around what is this thing.
Have you got a general statement?
Yeah, statement. Yeah, there's a statement. There's a paper being published recently. They basically 37 out of 40 were able to agree, which is pretty good when you think about, people say, is it sugar addiction? Is it food addiction? Is it carb addiction? Is it ultra, what do we call this thing? Was the number one question, actually, because we all felt if we don't get behind what we call it, nobody's going to take it seriously, really. So we managed to get everybody to agree ultra processed food addiction, because that's where there's most evidence in the literature. And it's also, like we were just saying, kind of pointing the finger where the finger needs pointing. So that's been agreed. And also was agreed the fact that if you actually take the criteria for substance use disorder in general from either the DSM, which is the American system, or the WHO ICD, lots of initials. The WHO has 6 criteria for substance use disorder. I mean, they all map perfectly onto the behaviors that people have around food: cravings, tolerance, withdrawal symptoms, losing interest in, other activities, continuing to use the substance despite knowing it's doing you harm, losing control of the amount that you have, kind of saying you'll just have a little bit and never being able to stick to that. So those are basically the 6. And we all recognize that with food. Like, most of us are going, yes, yes, yes. I mean, I would have had 6. So we kind of agreed that as well. So yeah, that was a super useful exercise. And we can definitely, I'll send you the link so we can link that for people in the notes. And the other thing is that it's taken us a few years, but we were doing a treatment study ourselves, because there, as I say, there's nothing much in the literature. So we took everything we thought we knew. We designed our sort of best guess about what a good treatment would be, both on the food side, but also on the kind of psychology side and the education around the addicted brain and stuff like that. So we put it all together, did a 10-week online intervention ourselves, some guys in America. I don't know if you've come across Sweet Sobriety. Molly and Chrissy are co-hosts of Food Junkies. Come across Food Junkies podcast.
Oh,
with Vera Common.
No, yeah, I haven't.
Really good. And they've interviewed just about anybody who's anybody in the food addiction space. So the Food Junkies podcast guides also run a service they call Sweet Sobriety. So they run a intervention service in the States. So they joined in, and some guys in Sweden, Charlotta and Frida from Live Sugar Free, And we all had similar programs, and we all kind of got people to fill in the questionnaires as they went along. And then also we did, which we're proud of, really, a 12-month follow-up, which a lot of studies don't do. They kind of do, oh yeah, everybody does really well with our program, but they don't follow people up. So we followed them up for a year, and we've just published that, and great results, really. We got, for people who completed it, I think it was 62% in remission from food addiction, and sustained improvements in the Yale Food Addiction Scale, in the mental well-being scale, and also our own questionnaire is called Craved. It's based on those 6 criteria that we talked about. So it's like a screening questionnaire that professionals can use. So yeah, and sustained improvements on that. And the vast majority of people who were in this, severe food addiction category at the beginning have moved, and there's a significant proportion of people in the no food addiction category on the YFAS at the end. So, we've shown, if nothing else, that food addiction is a treatable disorder without drugs, basically. So we've been busy doing that, the consensus thing. Yeah, so the other point, of course, is that because it's not a recognized condition, we're all campaigning for it to be a recognized condition. And Ashley Gerhardt, who's behind the Yale Food Addiction Scale, and colleagues have submitted to the American system. And we've just resubmitted, because we had made a previous submission to the WHO to have ultra-processed food use disorder recognized as an official condition. And anyone can actually go into the system and support that application, or to comment, if you think it's true, or if you want to add anything, or if you disagree with any of the points. You can actually literally go into the system and do that. Probably people would have to contact me if they wanted to know how to do that, because you have to set up an account first, but it is in the public domain. So we really hope to get a lot of support for that. I mean, whether they'll say yes this time, I don't know, but I think that there's been a lot of change. I don't know if you feel this as well. There's a lot of momentum against ultra processed foods now. There's a recognition that they're addictive, so I think we're definitely going in the right direction.
Yeah, I think I see, and just talking to people in general, not just in this space, there is more awareness that they are addictive, that it is the ultra processed foods rather than anything else particularly. So hopefully, I'm not holding out much hope with the WHO, but I think there's too many conflicting interests, or
I mean, that there is that. And in fact, in the first time they rejected it, one of their points was there's no consensus. So we feel we've kind of dealt with that. One was that there's no outcome studies, so we hope we're sort of contributing to that. One was a weird one, which we were like, oh, I don't know what you could do with that. Essentially, their point was it'd be too confusing to bring in a new diagnosis. So we're like, well, I mean, I just don't know where you go with that, really, because if the evidence is there, if it's confusing or not, you have to bring it in and then just train people. Oh, I remember the third point was, aren't these symptoms already accounted for by diagnoses that are in the ICD? So what they essentially meant was, is it not just accounted for under obesity or eating disorders? But in the expert consensus, we were all very clear, like, yes, there's overlaps with obesity, because obviously if you've got ultra processed food addiction, it's really likely that you're going to end up in an obese category.
yes.
But they're not exactly the same, because about 11% of people with food addiction are actually underweight or normal weight. And we all know people who are underweight or normal weight who have terrible food addiction problems. So that's number one. And number two, then again, there is an overlap with eating disorders, particularly with binge eating disorder, clearly, again, because some of the behaviors are shared, but they're not the same condition. You can definitely have a binge eating disorder, and it's not about food addiction. It might be about body image distress. It might be about over restriction. It might be about kind of many things. You can have a food addiction with or without binge eating disorder. Maybe with food addiction aren't binging as such. They're maybe grazing, or anyway, they're separate.
Yes,
everybody.
I agree. And if there's one for alcohol, I'm not going to say nicotine because I don't think nicotine is particularly addictive. I would say more cigarettes because they have chemicals in that make them addictive, and
Have
sugar and sugar.
the delivery system which gets it fast to the brain. With any addictive substances, how fast does it get to the brain? You know, and how refined it is. So
Yeah.
yeah,
Um, Gambling,
yeah,
sex, any of these addictions, you
yeah.
know, that if that can be treated or even diagnosed,
Hmm.
then why can't processed food? But, you know, my cynical head goes to, well, because there's a lot of money in ultra processed food.
A different
So,
conflicts. But I mean, same with cigarettes in a way, and it's almost like history repeating itself because you know the cigarette industry said it wasn't addictive. You know, they're on record saying that they hid the science and they're obfuscated for years. I mean, obviously they didn't want the harms recognized, and it's exactly the same again.
and then they went and bought all the food companies.
And then they bought the food companies.
And so they just took their means and ways and put it in the food.
And it's since that point that we've really had a problem with the food, and it's become kind of ubiquitous. And really, the absolute crime of selling these foods, which they know are addictive to kids.
Yeah.
And there's a case in the States, you've probably heard, I don't know if you have, they've taken one young man who has kind of suffered terribly from eating those like the sugary cereals and the Coca-Cola and all that, and they're using him as a test case to sue the food companies for the fact that they marketed these products that they knew was harmful, they knew were harmful to children.
Hmm. And I think for anybody listening who doesn't already know that the cigarette companies bought the food companies, this was back in the 80s. So
Yeah,
we're looking at 4 decades of food being manipulated to make it addictive.
yeah.
And
That
and they'd already had 4 decades of how to make cigarettes addictive and what to put in it. And so
yeah,
I think, you know, that they're very expert at it. And I once had on a guest and she didn't talk about it at the time, but she used to work for Pepsi. But
yeah.
offline we had a conversation on how they manipulate the food and they adjust it chemically and
Mm.
everything to make it more addictive. So it's a known fact. It's just that they don't want people to know because
Yeah,
if
yeah.
people are eating real food, which they're doing a very good job of trying to destroy our real food, then they're going to be losing
Mm.
trillions and trillions of dollars.
Yeah. They literally, you know, would put people in brain scanners and feed them the various formulations and see which lit up the reward centers of the brain more. So that, you know, we've actually been had, we're like rats in a rats in a maze, basically. Yeah. So just eat real food, folks.
Yeah. So I remember back, and it's stuck in my head. Back in 2009, I read A Wheat Belly by Dr. William Davies, and he was showing how wheat lights up the same receptors in the brain as cocaine.
Yeah.
And so that has really stuck with me all that time. And I from then I did stop eating wheat for about 9 months, and then I got back to it, and it's so addictive. I couldn't stop. I knew I shouldn't be eating it, but I couldn't stop eating it. And I used to drive 6 miles a day, Monday to Friday, to buy fresh bread.
Yeah.
So
You were very motivated to
I
get
was. It is good bread, you know.
driven by dopamine, which is the motivation neurotransmitter, and it's the neurotransmitter that's involved in all addictions. You know, it's the neurotransmitter that gets hijacked because of the high levels of stimulation you get from refined grains, sugar, um, yeah, and other things like you said,
Even
other additives that they put in, caffeine. They often put in ultra processed foods. So no, absolutely, yeah. Knowledge is something, isn't it? That knowing that stuff is really important for people, and that's the sort of education piece. But in a way, so for example, people knowing that cigarettes do them harm didn't help everybody quit cigarettes because it's addictive. So you can't just do it. is trying to tell you one thing, and then your primitive brain, which is the bit that's sort of where the reward center is, it's sort of been hijacked, is actually more in control of our behavior than we think. And things used to happen to me, like I'd get home from work, I'd get up on a Monday morning, I'd say, right, no more biscuits ever, not today, blah, go to work, have a hard day at work, come home hungry, and there's biscuits on the side for the kids. And my disembodied arm would be reaching for these biscuits like I'd never said that in the morning. And I'm sure people can sort of relate to that. And it's because that reward center drive and the dopamine starts the minute you think about it, and it's driving you to do this thing. It's a survival mechanism. So I'm talking at an ancestral health event in a couple of weekends' time up in the north here. And I'm planning a talk, and I'm sort of revising again the fact that, we're so wired for that environment that we used to live in. We're so adapted for that. We're so driven to survive that when we see these foods, we just lose control. It's a survival mechanism that we wanted to be, as fat as we could to survive the winter. We ate all the fruit, we ate all the berries we could find, but we had to look really hard to find them, and we had to suffer a little bit, and we needed to be really motivated. And of course, in the modern environment, you don't have to be very motivated to just ring Domino's and get it delivered to your house. I mean, there's no effort, there's no danger. It just messes with you. You get this massive spike of dopamine from having eaten that refined flour, and then what goes up must come down, like any drug. So we're just not adapted to the world that we live in. But so individually we have to try and create our environment so it's a bit more ancestral. So for example, we just don't have any processed food in the house. We've only got the kind of foods we want to be eating, real foods. You're so cued by kind of seeing things, smelling things, that habit of going in the cupboard or whatever. So I mean, it can take years to change these behaviors, but it's really essential to try really to make your lifestyle and your home more caveman
Friendly. Yes.
caveman friendly.
But I recognize that it's hard if you're living with other people that are not doing what you're doing. And so
Yes,
I tell people to have
yeah,
a separate cupboard, put your own food in there so you're not going to the other cupboards. And I still find myself sometimes going to Julian's biscuit cupboard to look for something. And thankfully, he never has anything that I like the look of, and I just shut the cupboard again.
yeah.
But I still catch
Well,
myself doing it.
like, why is my hand doing that? Because you're not you don't want it, you're not going to eat it.
Well, sometimes I do want it. So the fault's there first. Oh, I'll go and see if he's got something there. But I look and then I think, no, he hasn't got anything that would be worth eating. So I just shut the cupboard and walk away. And maybe I'll choose one of my homemade chocolates that I've made, and that will satiate me, whatever it is that I'm trying to soothe.
Yes, you've got that. Yeah, I mean, yes, it's not easy. It's simple. The advice is really simple.
Yeah.
Abstain. For people with food addiction, you have to abstain sort of 100% from your drug foods and those behaviors. It's not easy. No one's saying it's easy. You really need support. You need to work with other people. It takes, I'm still working on it like you. We've been low carb for about 14 years, and I've been, I understood I was a sugar addict maybe 10 years ago. So you have to keep working on it.
Yeah. So you've got the conference coming up. Tell us a bit about the conference in September. And I think there's still tickets available if people want them, aren't there?
Yeah, definitely. Yeah, we've got some tickets left, both in person, but also live stream if people can't get to London. Yeah, so as you say, it's in London. It's the Royal College of GPs, which is right by Euston, so it's quite handy if you're coming from the north.
Yeah.
We've got 2 days this time. Last year we had 1 day, but this year we've got 2 days. So we're quite excited. Day one, I'm just getting the list of speakers up so I can remember all these marvelous people. Day one is more focused purely on food addiction. What's the latest? Some of the things I've been talking about. And day two is on comorbidities. So, I was saying about food addiction is linked with obesity, type 2. It's actually also linked with cancer, with mental health problems, with cardiology issues. So we've got speakers on all of those sort of comorbidities, if you like. Who have we got that's marvelous? Dr. Georgia Eade.
Oh, yes.
Marvelous Georgia on day 2, obviously talking about mental health, and she's bringing Albert Danell from France, who was the guy who did all the data. I don't know if people have seen Georgia's paper. He is a psychiatrist, and he actually treated inpatient, severely long-term mental health patients with keto to see what happens to their mental health, and he got the most incredible results from people who'd been decades on medications and stuff. So he's coming actually as well with her to share her slot. We've got Trocal Agent, who's never been to the UK,
Hey, yeah.
UK, I think, but he's never I don't think he's spoken, and he's never been to London. So he's going to talk about obviously obesity and food addiction. David Unwin, who's he? Dr. David Unwin,
Oh, I don't know. Let me think.
history person.
Anyone you know?
He's working a lot recently in his clinics with food addiction, trying to help people get to that root cause of why their blood sugars are in a terrible mess, and people trying to, for example, they're kind of listed for surgery, say for a knee op or something like that. The surgeons and the anaesthetists won't actually do the operation until they've either got the blood sugar or the body weight down to a level that they agree to. And so he's finding quite a few food addicts. So he's going to talk about what you actually do in primary care. So that's a good one for the professionals. On the campaigning side, we've got Marrero from UNICEF, who's going to talk about what they're doing to try and improve the food environment for children, food and beverage environment for children. We've got Scott Murray. I don't know if you've heard Scott talk on cardiology.
Only last year when we were at the PHC conference in Glasgow, but he couldn't get there. We just had his video. Yeah, so it'd be good to see him in person.
Such a good speaker. And his is From Mitochondria to the Morgue.
Oh, gosh.
Great title. We've got Nasha Winters that we all so fond of, who's a sort of holistic cancer specialist. So she's going to be talking about the food environment and then the environment that creates within the body and all the problems that can sort of come with that. We've got Karin Thompson, that some people may have heard of. She had an international modeling career, but it's a self-confessed food addict, and talks about all the distress that's caused in her life. And she also did do residential treatment for people with food addiction over in the States. So she's going to be, and she's very, again, another sort of real inspirational speaker like Nasha. We've got Simon Dankel, who's actually from Norway, and he's going to talk about cancer as well. So there's a really nice spread of people from various places with various interests, but really the sort of message is, what's the latest science on food addiction? What do healthcare professionals need to know? But people listening who are interested in general public, we had a lot of people from the general public last year come and attend. You're absolutely welcome. We've got a bookstall, got a few, like 9 exhibitors, I think. And all the food is gorgeous at the Royal College, and they really work closely with us. So it's all real food, no seed oils, no grains, no sugars added to anything, so you're completely in the hands of professionals when it comes to the food, which I think is nice when you live this lifestyle and you can just relax and go to a conference and you're not picking the lettuce and ham out of the middle of a sandwich or something,
Yeah.
And then
I think of all the PHC conference food, I think the Royal College of GPs was the best.
Yes, they do really good food. And there's a new chef, so I was kind of talking to him, but he seems to have completely understood the brief. So that's good. And obviously it's lovely to come in person, isn't it? Because you have those great conversations, you kind of meet people and hear people you wouldn't have otherwise connected to. So
yeah, and I love meeting people in real life that I've seen online or heard of online or even interviewed.
yeah.
So,
Yeah, that's right. You've met people on social media, and yeah, so there's so I didn't mention David Wiss, but we've worked with him on our treatment paper. He's a guy from the States who again has his own lived experience of both drug and food addiction, and he's set up Nutrition for the Mind. He's a dietitian, but he's an academic as well, and he's done a lot of work on food addiction and early trauma, food addiction and sort of mental health problems. And so, yeah, he's coming as well. And I've never actually met him in person. He had to speak online last year because his wife was having a baby during the conference. So he did a recording. But yeah, so people that you've sort of, yeah, really feel you know, but you've never actually met.
Yeah. And I believe we can have, so anybody listening who wants to come, so tell people the dates and then tell them.
Yeah. So 4th and 5th of September, I'll give you the link. You can find it on Eventbrite. It's called IFAC, IFACC 2025. So it's 4th and 5th of September. Yeah, but there's going to be a special code for Jackie's listeners, and it will be TFKP, and it will get you 40% off in person or live stream tickets. So we're going to set that up.
Yeah, fabulous. So people can watch from home. The live stream, is it recorded? Can they catch up if they can't attend live?
Yeah, absolutely. So obviously, if you're in Australia or somewhere like that, or if you're just busy those 2 days, you can buy the live stream and then you'll have the recordings to listen to in your own time. I'm pretty sure if you buy in person, we're going to send you the videos as well. Don't hold me to that 100%, but I'm pretty sure that's the case. If you come along, you'll have access to the videos for free.
Fabulous. So, tell us about you being a co-editor on the Frontier.
Yeah, that's another thing this year. So Frontiers in Psychiatry invited us to do a special issue on food addiction. And so that's sort of been running along. We've been taking submissions and kind of editing the papers through. And I think there's 10 or 11 so far. They publish them as they get approved. So there's 10 or 11, but there'll be 15 ultimately. So again, we can give the link. And again, it's just the latest, what people in the space are publishing on food addiction, the mechanism, the treatments, all of the stuff we've already been talking about, really. So yeah, there's some
So you're involved in that.
So I've been the co-editor with David Wiss that I just mentioned, and Adrian Sotomota, who
Yeah.
came to this conference. Yeah, from
It was there 2 years ago.
yeah,
Well,
so
18 months ago.
we're editing that. And then there will be another special issue, but it'll be Frontiers in Public Health, that's coming out following this year's conference. But Nicola Vina, who some people will have heard of, she's really the main person in the neuroscience of sugar. She's going to be hosting that, so that'll be launched at the conference, and then the speakers and other people will submit to that as well. So again, there just does seem to be that sense of the ball rolling, really, with this whole idea.
So if you've got 14 or 15 papers coming through of research, that should support that WHO.
Exactly. Yeah, and some of them we've sort of quoted in the current submission as well.
Yeah, fabulous. So is there anything else? Is there anything else we can tell people about the conference other than I'm going to be there, of course? So everyone should come and say hello to me.
I'm trying to think who else is going to be there that's interesting. Jack Mosley, Michael Mosley's son.
Oh,
Yeah, so he's written a book. It's recently come out called Food Noise, which is essentially about food addiction, but also about, what do we think about these GLP-1s, which David's going to be talking about as well at the conference. It's important. So many people have taken the leap and are trying them. What do we think of the pros and cons? Who are they really going to help? So Food Noise is Jack's book, and he'll be there, obviously selling his book and doing a signing. We're going to have Claire Wilcox's book. She can't come, unfortunately. So she's a psychiatrist, but sort of neuropsychiatrist in the States. And she's got a new book out called, I've got it here, Rewire Your Food Addicted Brain. Fight cravings and break free from high sugar, ultra processed diet using neuroscience. Claire Wilcox. So it's really good, actually. I read it before it got published. So you can be able to buy that book there. There'll be other books to buy. What else is there to try? I'm trying to rack my brains, like who's exhibiting. I can't remember, so I'm not going to make it up.
yeah. Okay. Excellent. So is there anything else that we haven't spoken about today that you wanted to mention? Anything I've forgotten to ask you or should have asked you? Or
I think that's mostly it, really. Yeah, excited about the momentum that's gathering, that there's more and more acceptance, as you say. And just keeping that going, really. And people join, if you're interested in the charity, or in volunteering to help on either the Collaboration for Kids project or the Food Addiction Solutions project. As I say, we're all volunteers, but if anyone's got any time and any expertise, they think they might like to come and join us and contribute to the team. It doesn't, you only need probably a few hours a week. It doesn't have to be a massive commitment. Please get in touch and come and join us. If anybody doesn't want to come to the conference or can't doesn't want to do the live stream, we take donations very gratefully just to keep this work going, to run the conference. Next year we're probably going to be in Poland. How exciting, with the Rodson brothers. So we're just in discussion with them, and I think it's almost certainly going to happen. So because it is an international food addiction conference, we feel we ought to move it around the world a little bit. So we're setting off to Poland next September.
The brothers, they were at Sheffield, weren't they?
They're at Sheffield, and they did come to IFAC last year, but their own conference is just the week after ours this year. Theirs is the 11th and 12th or something of September. So, and Georgia's going from our conference to theirs, but so they can't come to us this year.
Oh, I quite fancy Poland. I've never been to Poland.
It's a beautiful place. David and I have done their conference a couple of years ago. It's an amazing venue. These guys are incredible. They've got such a following in Poland. They get 2,000 people on the second day of their conference, basically general public. 2,000 tickets they managed to sell. We're so jealous. And on day one, they do healthcare professionals, and they get about 400 for that. So they've really got a big following. They're very energetic, very positive. Yeah, it's really interesting what's going on over there, and they've definitely got that momentum. So, and they wanted to do something on food addiction, so we said, well, why don't we bring our stuff to you? So we're just currently thinking about which speakers might be good, stuff like that.
Fabulous. Jen, I'm looking forward to seeing you in 4 weeks' time.
Yes, definitely, 100%.
Oh, well, it's 30 days, a month. We're recording this on the 4th, and it's on the 4th. So
it's on the 4th, yeah, exactly.
Yeah. Excellent. Perfect. Tell people how they can buy a ticket, where they need to go.
Yep. So you can either go to the website, which is the-chc.org. And if you go to the FAS page, which is Food Addiction Solutions, you'll see conference page, and you can click through from there to either live stream or in person. Or if you've got an Eventbrite app, or you go on Eventbrite on your laptop, go in Eventbrite, put in London, and then put in IFAC, IFACC, IFAC. It'll definitely come up. And again, I think that usually takes you to the in-person ticket. But if you click on that, there is then a link to go to the live stream if that's what you're looking for. So you can use either method there to find the conference tickets.
Yeah. And then remember to use TFKP, as in the Fabulously Keto Podcast, for a 40% discount. That's massive. Wow. Thank you.
You're welcome. Excited. Yeah, please come, everybody.
So can we finish with your 3 top tips?
3 top tips. Well, we've talked about one, which is like curate your environment. So remember that you're a cave person, and you're driven to eat highly calorific and dopamine inducing foods. So if you have them in the house, you're probably going to eat them. So don't have them in the house is tip number 1. Tip number 2.
I've got a client, and she has a food safe.
Yeah.
Her husband and her son have the key, and they can open it, and she can't.
Yeah, definitely. We've done stuff like that with people, or they've got a filing cabinet in the house, so they just empty a drawer, and one drawer is only for certain people in the house, that kind of thing. Empty a freeze, don't have ice cream in the freezer, that kind of thing. That's really important. I think number 2 is to acknowledge this thing about it's easy but it's not simple, and that really it's a bit of a lifelong journey. So be kind to yourself. If you slip up, don't beat yourself up. That's just going to make things worse. It's about sort of self-care. It's about looking after yourself. If you slip up, why did that happen? What was going on? Was it an emotional thing? Was it just because it was there, or you didn't like to say no to somebody, or analyze that situation and think what you do differently next time. So be kind to yourself really would be tip 2. Tip 3 would be for food addiction. I think it's really important to get some kind of support around yourself, whatever that be, someone else who's kind of doing it with you, or join one of these online. Overeaters Anonymous is free. They have loads of online stuff if that approach would suit you, or there's other online courses and support groups that you can join where you're with people who kind of got this same problem. Like Jackie was saying, if you're in a house where everyone can actually moderate the amount of those foods that they eat, God knows how, but they can, you need some people in your social world who are dealing with that same challenge as you, so you feel not alone, and you can talk to them about it, you can feel supported. I think that whole social side, again, it probably goes back to caveman brain in some way, but I think that whole social side is really important. So reach out if you want any more information about that. I mean, I should probably mention, shouldn't I, my little book Fork in the Road,
Yes.
I wrote in lockdown, and it's still for sale on Amazon. I'm just about to do edition 2, actually. I'm updating it, and you can order that from Amazon, and all profits from that go to the charity. They go to the work that we're doing. There's a journal that goes with it. I don't know if it's going to be...
You've got a journal as well.
Here we go.
About that, yes.
A day journal. It's a bit out of focus. So you can do 100 days of kind of journaling and reflection. It's sort of supposed to go with Fork in the Road, but anyone else who just wants to sort of reflect on where they're up to with their eating habits, then it's a good thing to do. So
Yeah, fabulous. Thank you so much for joining me today.
Thanks for having me on, Jackie.
You're welcome, anytime. What a fabulous conversation with Jen Unwin, and her passion and dedication to the field of food addiction really shines through, and you can see that it's something that she is dealing with all the time as well. Jen said ultra processed food addiction is real, and it's time we treated it as seriously as any other addiction. With the right support and knowledge and environment, it is possible to recover without relying on medication. So don't forget, if you'd like to attend the conference in September, whether in person or via live stream, or catch up on the recordings after the live stream, use the code TFKP for a 40% discount. You'll find all the links mentioned in the show notes. And if you do come along in person, make sure to come and say hello. I'd love to meet you. Until next time, stay fabulous. And if you want to join my workshop next week, then go to fabulouslyketo.com, wait for about 10 seconds, and a pop-up will show you a link to the sign-up form. See you then, and hopefully see you at the conference on the 4th and 5th of September in Euston, in London. See you there. Disclaimer. The content of this podcast is for informational and educational purposes only and is not intended as medical advice. Our guests, whether healthcare professionals or not, are sharing their personal opinions and experiences. This does not establish a doctor-patient relationship. Always consult a qualified healthcare professional before making changes to your medications, treatment, or lifestyle, particularly if you're on medication or have concerns about your health.